Hi, everyone, and welcome to the Aihm Weekly Wellness Webinar. This week, we're so excited to have Dr. Christopher Nee with us from Fullscript. He'll be speaking on healthy habits, supporting patient behavior change in integrative medicine. So we'll let folks come into the meeting. People are just starting to join. So we'll take a few minutes just to let everyone come on in. And while we're doing that, I'll just give you all a little background about the Academy of Integrative Health and Medicine. The Academy is actually 3 different organizations that merged into one. We're a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we are the coming together of the American Holistic Medical Association, which started back in the 70s, the American Board of Integrative Holistic Medicine, and the Academic Collaborative for Integrative Health. So we would love you to join our community and be a part of all of the great activities and networking that comes with bringing together interprofessionals in the integrative health space. I'd also like to let you all know, if you're hearing about our fellowship program for the first time, you can actually get a discount by mentioning this webinar and Dr. Christopher Nee. So our next fellowship, which is a 2-year program in integrative health and medicine, is beginning in October, and we still have a few slots left. So if you're interested, please apply today. So I'd really like to welcome our special guest today. Dr. Christopher Nee is a naturopathic doctor. He's a clinical researcher and natural health and wellness expert from Ottawa, Canada. He is on the research and he's the research and education manager for Fullscript's Integrative Medical Advisory Team. And he's very passionate about evidence-informed practice, patient education, health services research, and advancing our understanding of natural medicine. He's worked with a variety of organizations, including the Ottawa Hospital, the Ottawa Police Service, the University of Ottawa Heart Institute, the Ontario Association of Naturopathic Doctors, the Canadian College of Naturopathic Medicine, and Valiant Pharmaceuticals, Nordion, and Pfizer. So Dr. Nee, it's such a pleasure to have you with us today, and looking forward to your presentation.
Great, thank you for having me. Just give me 1 second to pull up my presentation here. Okay, and I guess let me know if you can see that okay, or if you can't see that okay. Otherwise, we'll go ahead and get started. Great. So thank you again, Tabby, for the introduction, and to the Academy of Integrative Health and Medicine for having me today. As I mentioned, my name is Dr. Christopher Nee. I'm a naturopathic doctor and the Medical Education and Research Manager for Fullscript. So I'm really excited to be here today to talk more about this topic of healthy habits and behavioral change in integrative medicine. So it's an extremely broad and complex topic. We're actually going to develop an entire course on it, so we can't possibly go through everything in a 1-hour webinar, but I wanted to take the opportunity to highlight some of the key concepts as it's relevant to integrative practitioners, and hopefully leave the audience with some strategies you can start implementing today or tomorrow in your practice to kind of support patients more directly with optimizing behavioral and lifestyle change. So again, here's a quick outline of the presentation. We need to kind of start with this topic of treatment adherence, in case that's a term you're not familiar with, as it's really relevant to understanding how patients need to follow a treatment plan long-term to experience positive health outcomes. Then we'll talk a little bit about kind of some of the behavioral change concepts that you need to be familiar with. Most importantly, I want to share some insights from a large patient survey we just did. And then, like I said, a large focus will be on providing you with some actionable strategies. So first, before we get into kind of the detailed theory, I'll talk a little bit about just kind of who I am, how we got here, and again, this topic of treatment adherence. So as mentioned in kind of my bio, I'm a naturopathic doctor, originally from Ottawa, Canada, went to the Canadian College of Naturopathic Medicine and graduated in 2013. And I completed a undergrad degree and master's in nutrition from the University of Guelph. And it was actually during my time at Guelph that I became exposed to kind of natural medicines and natural health products, did a lot of research in this area, and became very passionate about wanting to understand natural medicines and how we can kind of integrate them better within our conventional healthcare systems. So I've worked with a number of different organizations over the years to try to advance that understanding through research, through education, and with direct patient interactions and engagement as well. And so I'm really happy to be here today to kind of speak to some of that experience and talk about how we can move forward. I had the opportunity to join Fullscript about 2 years ago. And in case you're not familiar with Fullscript, it's a health technology platform within the integrative medicine space that essentially focuses on optimizing delivery of high quality supplements directly to patients via a practitioner. But beyond just kind of facilitating the delivery of those treatments, Fullscript is actually evolving to be more and more of a research and medical education platform. We're trying to find more innovative ways to support the practitioner and patient relationship. And part of this is through the research we've done over the last couple of years on the topics of treatment adherence and more recently, behavioral change. So this is just a quick snapshot of some of our research program over the last 2 years. So I mentioned I had the opportunity to join to really try to find ways to kind of grow this research program and deliver kind of medical education and find ways to impact our industry. We started in kind of March 2020, focusing on this treatment adherence topic. We launched a major white paper on that last summer, which was peer reviewed by IFM as well as the University of Maryland. And one of the main kind of findings that came out of that treatment adherence work was identifying the fact that behavioral or lifestyle changes are really a fundamental barrier to patients actually following a treatment plan and being able to get better long-term. So then we thought, well, we need to become experts on that as well. We need to find ways to support practitioners in optimizing behavioral change for their patients. So we undertook a very large research study again over the past year on behavioral change, which has just recently been completed. So we have a fully designed white paper that was reviewed by the Institute for Natural Medicine. And as you'll see, we'll share kind of the link through the emails in the chat today. There's a link to a landing page where you can go ahead and download that white paper report, which is going to have a ton of more detail beyond what I can cover here today. So again, why should you care about this topic of behavioral change and kind of lifestyle? Who is this relevant to? Well, first and foremost, it will be relevant to kind of any type of integrative practitioner because we know integrative medicine has a foundation in kind of lifestyle medicine. But particularly, I called out a couple of practitioner types here, NDs, dietitians, nutritionists, and nurse practitioners, where you might find you have kind of a particularly well suited to address behavioral or lifestyle change. And there's a few possible reasons for that. Number one, we tend to recommend a wide variety of treatments. So we kind of touch on all the different possible barriers to kind of improving health. We tend to focus on root causes and identifying those barriers. We tend to have longer appointments, which might mean that we might have a little bit more time and flexibility for that one-on-one kind of coaching and support. And lastly, I think this is an opportunity to help these practitioners provide that individualized behavioral change and adherence support. So I've mentioned the term adherence a few times. So again, just to touch quickly on this so that everyone is on the same page in terms of what this means. Adherence, which is a term you'll hear a lot more kind of moving forward, is basically the extent to which a patient follows that mutually agreed upon treatment plan. So this is a little different from the term compliance, which is all about kind of whether or not a patient follows what you tell them to do. Adherence has more to do with, what you've decided, the patient working with them to kind of agree, yeah, this is what we want to do, and finding all the possible reasons why they were or were not able to kind of follow those recommendations. And what we found through our research over the last 2 years is that a surprising number of patients don't actually even initiate treatment recommendations that they're given. So around 15% of patients to 30% won't even start a new treatment that they're given. And that rises up to about 50% of patients not following recommendations beyond about a 6-month period. So if you think about the proportion of patients in the US and North America and globally that have a chronic disease and should be following kind of lifelong recommendations to address that, over half of them are not going to be doing that. And there's a lot of different reasons for that we'll cover. But again, this has obviously tremendous impact on our healthcare system, increases risk of hospital admissions, morbidity, mortality, and obviously healthcare costs as well. And in 2003, the World Health Organization covered a kind of landmark study on this, where they did a massive white paper report and review of the topic of treatment adherence. And they identified these 5 domains, which are basically some of the key areas and reasons why patients won't follow a plan. So as you can see, everything from kind of patient-specific factors to socioeconomic factors, factors related to the healthcare system or the practitioner. So again, a little bit different from compliance, because instead of the focus being on the patient and them kind of failing, the focus is more on looking at it integratively. What are all the reasons why this didn't happen, and how can we identify those barriers and set them up for success? And we actually did some of our own research with our own practitioner users as well. And we kind of surveyed them to figure out, well, what do practitioners feel like are some of the barriers to a patient following a treatment plan? And not surprisingly, most of them said things like cost will have a big impact, their readiness to change, and feeling overwhelmed by the plan. And again, if you kind of produce a bit of a mind map around this and think about all the possible reasons why a patient might not follow a treatment plan, we really wanted to dial in on this first category of behavioral factors. So understanding more that if adherence is important for long-term patient outcomes and reducing risk of chronic disease, and behavioral factors are a main barrier to adherence, then what can we do to learn more about behavioral change to better support practitioners in delivering optimal care? So this is where we introduce the topic now of behavioral change. So we'll talk a little bit just about some of those key concepts and theories that I want the audience to be familiar with as you begin to kind of wrap your head around the best way to provide behavioral change interventions. So obviously, we don't really need to convince most of this audience about the importance of lifestyle in health, but when we started to actually research behavioral change, we came across obviously a lot of different statistics, a lot of population health research that show things about just the stark amount of lifestyle factors that increase risk of chronic diseases. So still among Americans in 2016, 77% not being within a normal BMI, over half are not kind of meeting basic physical activity guidelines. A third of us are not getting enough sleep, obviously, 20%, so 1 in 5 people continuing to smoke, despite decades of research showing that obviously has a negative impact. So we start to realize that obviously everyone knows these are healthy habits that you should follow, or kind of negative habits that you shouldn't do, but there's got to be reasons why after decades people are still not able to kind of just live healthy lives every day. And we know that kind of doing some of these behavioral changes is important. This is a large meta-analysis done in 2012 that basically shows a stepwise or kind of dose-dependent response with increasing healthy behaviors. So if you look at kind of just improving 1 behavior, 2 behaviors, 3 behaviors, up to 4 behaviors, you actually see significant decreases in relative risk of all-cause mortality. So obviously, we know that even making a few changes can be helpful. And this is really interesting data from the National Nutrition Examination Survey as well. It shows that on average, most Americans are trying to do about 2 to 3 healthy behaviors, which is great. But what's concerning, in my opinion, looking at this, is that between the years of 2005 and 2015, the relative proportions of those patients didn't really change. So even though we have decades of research and everyone seems to have the basic knowledge and understanding that healthy behaviors are important, proportionally, we don't see more people engaging in more healthy behaviors, right? So there's got to be some barriers to that, and reasons why people seem to hit a roadblock or a barrier or plateau in their ability to kind of follow healthy lifestyle change. And we see as well from the research that there's more to it than just things like education. So you might say, well, people just aren't aware, they don't have enough knowledge, and that's true to an extent. But we still know that long-term, patients aren't able to follow these plans. They aren't able to make those changes despite that knowledge, right? And it's also more of an issue than cost. So you might say, well, like eating healthy is expensive, and exercise can be expensive, joining a gym and medications and taking supplements and so forth. And that's a fair argument. However, there is some research to show that even when medications, for example, are provided free of charge or as part of a public health care system, you still have relatively low adherence rates. So that kind of introduces the idea that maybe just beyond cost and knowing what to do, there's more to it in terms of the day-to-day habits that you have to form. And we also found in our research that we did, a possible gap in conventional care. So over half of the patients in some of the surveys indicated that they didn't actually discuss kind of they didn't discuss health behaviors or lifestyle changes with their family doctor. And that was despite, over 3/4, 70 to 89%, indicating that it would have been helpful and they would have liked that type of advice. And additionally, when you ask on the practitioner side of things, do you feel as a primary care provider, you're able to provide that lifestyle support? Around 50%, only about half of the individuals said that they'd be able to provide that support, and less than 20% of their typical weekly practice hours are dedicated to any kind of behavioral or lifestyle change. And we see in the bottom here, just some of the kind of medium time ranges where it can take from a patient actually being talked to about things like smoking or losing weight. So, I mean, anywhere from 4 to 10 years in some cases before it can come up as a topic they need to address in primary care. And there's lots of different reasons for that. So we're not, blaming any practitioners specifically, because it's a systemic thing, right? There's a lot of factors to it. So it can be everything from just having the education or the skill set on the practitioner part to provide that support. It could be about more the structure and the environment that they're in, the healthcare system. Are they in an environment where they're able to provide that support? Understanding whether or not, they believe they can provide support in an effective way, maybe receiving incentives. So are they able to bill for that kind of time? So a lot of different factors go into things. So that's where we wanted to focus more on, well, what are the kind of practice ready strategies that we can help provide? And for a number of reasons, we feel, that integrative medicine is particularly well suited to provide this type of behavioral change support, especially as an adjunct to conventional care. And we've seen here with some of the research, so if you look at some of the colorful bars here, this is basically the percentage to which patients engaged in healthy behaviors based on the type of kind of integrative or complementary treatment they were seeking out. So if you look at the dark blue bars, for example, these are patients that saw a naturopath or kind of participated in naturopathic care, and you see, a 62% increase in healthy eating habits, 39% increase in eating more organic foods. And this varies with all different types of integrative or complementary therapies. So all that to show that actually engaging in CAM or integrative treatments can help improve a wide variety of health behaviors, obviously. And we know that behavioral change is a hot topic as well. So it's something that we felt, okay, there's a lot of people out there that are trying to solve this problem. So what can we do in kind of an evidence-based way to provide some kind of medical education and research support to this integrative part of the industry? So like I said, we completed a large research project. We've covered some of the findings of that literature review. A few things I just want to highlight for you. This is kind of the long history of behavioral change and behavioral science. So we definitely won't cover this in detail, but please kind of refer back to it in the slides of the recording after if you're interested. But just to show that this is an extremely complex topic, it's rooted in psychology initially, but has had implementations now in all different types of lifestyle change. And if you look at some of the different theories that are out there that explain kind of why humans change behavior, there's around 82 behavioral change theories, according to a recent systematic review. But if you look at kind of the majority of the studies, they seem to focus on these 3 theories in the bottom right. So the Transtheoretical model of change, a theory of planned behavior, and a social cognitive theory. And the main one that I want you to focus on and to think about as we go through our findings is this Transtheoretical model of change. So this is pretty kind of popular model. You may be familiar with it. Essentially, there's 6 stages of change that go through pre-contemplation, contemplation, preparation, action, maintenance, and then either a relapse or termination. And essentially, this is just defining what point of the kind of behavioral change life cycle are patients at. So are they maybe not ready for change? Are they thinking about change? Maybe they've made some change and they're maintaining it, and so on. And we also found from the research that we did kind of a handful of ways to assess behavioral change, and we'll go through these in a bit more detail when we get to the specific strategies. So just to highlight for you a few of the findings of our patient survey. So we did basically a large patient survey. So we wanted to understand, okay, now that we've done that literature review, we have a better understanding of behavioral change in integrative medicine and behavioral science. How do our patients feel that use the platform, and what kind of behavioral change support do they need? What are they looking for from practitioners? And what do they report as being kind of common barriers, needs, or preferences? So as you can see from some of the demographics, I mean, our patient population is not necessarily representative of kind of a North American sample or population, but it is fairly consistent, to be honest, with our Fullscript user population. And it's a little bit closer actually to kind of patients that tend to use integrative or complementary and alternative medicine. So we do see that they are predominantly female, kind of middle age, mostly English speaking. But yeah, there's a lot of nuances there in the data that you can review kind of through that white paper report. And just to kind of validate that the patients we were seeing were actually part of an integrative model, we captured some other information about kind of the type of practitioner they've seen, and how they're kind of what kind of treatments they're receiving, sorry. And so you can see on the left here, basically most patients were seeing either a naturopathic doctor, medical doctor, nutritionist, nurse practitioner, or chiropractor, and then a few others. Most of them had been engaged with their patient or with their practitioner for at least a year. And most of them were getting help with either managing a chronic health concern, so over 3 months, or with general wellness and health promotion. And in terms of the types of treatments they were receiving, again, a wide variety here, which is indicative of kind of an integrative type of approach, usually a combination of supplements, diet, nutrition, lab testing, exercise, and then things like sleep hygiene, mindfulness or stress reduction recommendations, and so on. And just out of curiosity, most patients, when it came to supplements, were receiving anywhere from 3 to 5 or 5 to 10 supplement recommendations and had been taking them for about a year. Now, this is really interesting. Going back to that transtheoretical model of change, we actually asked the patients in the survey how they felt they had progressed through that model. So based on where they were at when they started seeing their practitioner compared to where they're at kind of now at this point in the journey, do they feel like they've been able to implement or act on change, or are they still kind of in an earlier stage, for example? So the blue bars represent kind of where they were at the start of the relationship with their practitioner, and the green is kind of where they're at now. And as I mentioned, most people had been seeing their practitioner for about a year. And what's interesting is that if you look, for example, at the thinking about changing and preparing to change versus the next two categories, acting on change and maintaining change, the relative proportions of the blue to green bars actually swap. So this shows that, you know, a relatively higher number of patients were in a stage of just thinking about change or maybe getting ready to change at the start of working with the practitioner. But over time, you know, at least about 6 months, they actually progressed through that cycle and were actually acting on change and able to implement that or maintain change. So again, it speaks to kind of the fact that integrative practitioners are playing a role in behavioral change support, and the fact that, you know, there are things that patients can do to kind of work through that cycle. And this is a busy slide, but I just want to highlight a few things. We actually asked about kind of the level or the extent to which they felt they were successful with changing behaviors or successful with following a treatment plan. And not surprisingly, most patients reported that they were most successful with following recommendations related to taking supplements, taking medications, going to get lab testing. However, patients were least successful with things like diet and nutrition recommendations, increasing exercise, mindfulness or stress reduction, and sleep. So not surprisingly, you might see this with most of your patients as well, that they are able to kind of maybe take some of the things with respect to supplements or medications, but when it comes to making that daily lifestyle change, it can be challenging. And we saw similar findings here with specifically changing health behaviors. Most people reported less success with actually changing activity level, stress management, or stopping potentially harmful behaviors like smoking or alcohol use. And in terms of kind of barriers to overall adherence, we had kind of surveyed practitioners previously about this, but this time we surveyed patients to understand what do they feel are kind of some of the barriers to actually following that plan. And not surprisingly, they said sort of the same thing. So things like cost of either the treatments or the visits, things like cost of healthcare goods, not having enough time, those are all kind of common barriers, and not feeling maybe motivated or having positive attitudes that they could actually follow the plan or change. And these are basically kind of very similar responses when looking specifically at behavioral change, cost of resources, not having enough time, and not feeling motivated or having that kind of positive attitude. And we actually saw as well that some of the adherence barriers were actually associated with those patient demographics. So we did some secondary analysis, and not surprisingly found that patients with, you know, either reported disability or lower socioeconomic status had kind of increased barriers of treatment costs and resources. Patients who didn't speak English, for example, were more likely to indicate that they had a lack of information or knowledge about their treatment plan or didn't receive proper feedback. So really important, as we'll talk about in the strategies component here shortly, really important to identify those individual barriers for your patients so that you can be aware of that and conscious of that when you're delivering care. So just to recap what we've learned so far, Not surprisingly, behavioral change is hard, but it is necessary for long-term health. And I would say, you know, this is something that every practitioner needs to spend a lot more time learning about and focusing on, because it doesn't really matter how great your treatment plan is. If the patient is not able to follow it, they're not going to have positive health outcomes. Patients do need and want support, and it requires an individualized treatment. And I think integrative practitioners are well suited for that. Just be aware of the main barriers being cost, time, and motivation, and the fact that obviously the more lifestyle-based components are going to be harder for patients to change. Okay, so we've covered a lot of information there so far, but I just want to start to switch gears now and talk a little bit more about those practical strategies that you can follow. So I've tried to group them into a few different categories here. So patient readiness, engagement, and motivation, patient empowerment and education, and then the specific behavioral change tools and techniques. So when you think about how am I going to support my patient with behavioral change, what are the different stages you want to look at? So first and foremost, before you do anything, you need to think about, is my patient even ready to change? Are they engaged in their treatment plan? Are they motivated, right? These are all important considerations, because again, if you just start talking to a patient about, oh, just do this, this, and this, and stop eating this, and run 5 times a week, but you've never actually talked to them about what they're open to or what they're interested in doing, then they might not be successful, and they also might not come back to see you. So something that's really important to be aware of. So like I said, before recommending anything, assess the likelihood that a patient's actually going to adopt the changes, especially if they're lifestyle rooted. So ask open-ended questions about, you know, what motivates them, what are their beliefs about changing, what are maybe some of the attitudes they have about change. If you're not familiar with motivational interviewing, please seek out some additional continuing education on that. There's lots of resources out there, but motivational interviewing is basically a core clinical skill that you need to be able to implement with all of your interactions with patients to basically find ways to kind of pull out of them the information that's most important and what's motivating them essentially, and learning more about them. Interestingly, from our survey, we saw that 70%, 71% of patients strongly believed that following their treatment plan would positively impact their health. And the 71% is reassuring, but I'm a little bit concerned about the 7 or 8% of patients still that either disagreed or strongly disagreed that the recommendations would improve their health. So something to keep in mind maybe as you're interacting with your patients is that maybe around 10% or 1 in every 10 patients won't actually agree with what you're telling them, right? And you probably have encountered that in practice. So it's just something to be familiar with. And you have to learn ways to kind of recognize that when you're interacting with the patient so that you can pause at that time and talk to them about it and provide that education and work through that before you go any further. And on the bottom right here, again, some more survey findings, we found that, the vast majority of patients, over 90% of patients felt that there'd be at least some change, if not a great deal of change required. So keeping in mind that, again, for most patients, even small changes are going to have a drastic impact potentially on their lifestyle. And you need to kind of talk to them about whether or not it's a good time for them, they have the resources, and whether they're open to that kind of change. And a really good kind of valid and reliable way to do this is through something called the Eureka Readiness to Change Questionnaire. So this is from the University of Rhode Island. It's essentially a 32-item questionnaire. You can help the patient kind of fill it out, or they can do it on their own. We've kind of designed a version of this, obviously referenced back to the Rhode Island Institute, that's available for free in our resource library, but it's a great tool that you might want to use. The great thing about this tool is that once you complete it, you can calculate the score, and it actually helps identify which stage of change your patient might be in. So again, it's a valid and reliable way to do that so that you can kind of use this as a starting point with your patient. It opens the discussion about, okay, well, I see that you're in a contemplation stage. So you're thinking about change. Now, why are you thinking about change? What are some of the reasons that you think you want to change? Do you need more information maybe, or more education about what might be involved with change? So before they're actually at the point of acting on change and doing things like goal setting or kind of planning and target setting, talking to them more about just like wrapping their head around changing and what that's going to involve. So depending on what stage your patient is in, they're going to have different needs, and you're going to need to take a different approach as a practitioner to best support them. So once you've identified which stage of that readiness to change your patient is in, you can think about whether or not your patient is engaged in their treatment plan. So patient engagement, again, is a whole other topic, but it's really important because the more patients are engaged in their plan, the more satisfaction they have with their care, the more likely they are to follow those recommendations and have that buy-in. And obviously, the more likely they are to come back and to continue to see improvements in their health. So these are just some kind of random questions that we came up with just to give you ideas, some seed questions to kind of start talking to them about their health. So you can ask about, whether or not they understand their health condition, whether or not they understand the treatment plan, how motivated do they feel, do they feel overwhelmed by the plan? These are all really important things to kind of identify and have conversations about in your visits. As I mentioned, patient engagement is really a core component of this topic of patient-centered care. Check out the AHRQ resources on this. It's a very large topic, but it's all about making sure that when you provide care, you're considering individual patient preferences, needs, and values. And that's obviously what drives kind of effective and long-lasting care. So make sure your patients are at a point where they're actually ready for change, make sure that they're feeling engaged with their plan, and find ways to engage them. So a couple of ways you could do this, like I said, with that motivational interviewing component, is thinking about what are their preferences and values. So instead of just laying out a treatment plan for them and saying, okay, do this for 3 weeks and come back, start to ask them, this is what I'm thinking would be helpful for you. How do you feel about this? Are there certain things you want to change? Do you think maybe we should adjust certain goals? What are you looking for, right? Like when I do for every new patient I have them complete a 1-week food record, and we review that food record at their second visit, typically as part of the assessment still. But before I say anything, I ask them, what are the areas that you feel you're doing really well in? And what are the areas that you feel you could use additional support? So instead of just volunteering information and my recommendations, which might be things that they're not really interested in learning about, I ask them first about what are their needs and where do they need support, and then we focus on those. Because again, they're more likely to be engaged at that point in making changes in those areas. So like I said, include them in decision-making and developing that plan. We see better outcomes from doing this. And if you do recommend supplements as part of your plan, consider all the different components of supplements. So again, do they care about things like cost, ease of swallowing, taste, delivery format, so a capsule versus a liquid? I tend to recommend a liquid magnesium product, but a lot of patients come back and say, I don't really want the liquid. Can I do something else, right? So really important to kind of consider these things up front before you spend all the time recommending something that they don't end up following. And on the right-hand side here, you'll just see a little bit of a checklist that we have. This is, again, a designed resource within our Fullscript library. Basically just kind of outlines some of the different third-party certifications and the different types of filters that we have within our supplement catalog, so you can kind of narrow in on things based on what your specific patient preferences are. Okay, so we've talked a little bit about readiness to change, engaging your patient, and then the last component of that first section was patient motivation level, right? So once you've realized, okay, my patient is ready to change, they seem to be engaged, they're good to go. Now I have to figure out, when I recommend things for them, how motivated are they actually to take those recommendations outside of the appointment now and start implementing change. So this is where, again, things like the motivational interviewing come in handy. I like to focus on that intrinsic motivation versus an extrinsic pressure. So again, as part of my intake form, I ask about their health concerns, but I also ask about what their goals are, right? So you want to relate things back to their goals. Well, your goal was to, have more energy. So we're going to try to optimize the quality of your sleep. And I want you to kind of focus on this. If you do these positive things, you're going to feel better, right? As opposed to just saying things like, stop staying up so late and you won't be as tired, right? So again, that's the idea of approach goals versus avoidance goals. So trying to give them a target to work towards based on something that's healthy, as opposed to just kind of punishing bad behavior. I do this with diet all the time as well. So I always focus on adding good things like veggie intake and healthy proteins. I never just say, well, you should stop, eating sugar and cut this out or cut that out, because that doesn't really give them the tools or the kind of information they need to actually succeed. And don't underestimate the role that kind of small wins have on motivation as well. So keep that in mind, that this will kind of become more relevant with simplifying treatment plans, as you'll see shortly. But focus on, even if you can set small goals for them, the more they start to kind of accomplish those goals, they'll be more engaged, more reinforced, and then they'll be able to tackle some of those kind of more challenging aspects that you want to recommend. So we talked about motivation level, just to highlight one of the questionnaires that could be helpful for this, the treatment motivation questionnaire. So you can look into that. It's a good option just for identifying things, where they're at in terms of their motivation level. We do see about a 70% improvement according to the research in adherence. So again, when you use motivational interviewing, you're more likely to narrow in on the things that are going to facilitate a patient following their plan. So try to do that as much as possible. There's lots of different ways to kind of improve the patient-practitioner relationship when you're interacting with them. So things like obviously empathy, eye contact, validation, active listening. These are all kind of core skills as well that we won't go into in detail, but things that are important to be aware of. And again, just a few kind of tips for motivational interviewing. I've provided a few examples of these, but things like asking open-ended questions, recognizing where their strengths are, reflecting as well what's important to them, and summarizing kind of where they're at, so that you're giving them that kind of feedback and that echo back so that you're on the same page. Okay, so we've considered things like readiness to change, patient engagement, and motivation level. Now you need to determine, if I'm going to move forward with trying to support my patient with changing, do they have everything they need to succeed, right? Am I setting them up for success? So some things to think about in this area are things like education. So are we providing enough patient education to give them the knowledge that they need? And am I keeping the treatment plan simple enough that they're actually going to be able to follow it? So I mentioned the Eureka questionnaire, the treatment motivation questionnaire. A third one that came up in our research was the health empowerment scale. So this is a great tool. It's much shorter, but again, it's open access and available. There's a copy of it in our resource library and in the app as well. And again, just helps you identify how patients, or how empowered patients feel, right? So are they able to kind of self-manage their care? Do they feel like they can make those changes? Do they feel like they can kind of cope with things? Patients who are more empowered are going to be able to kind of make more changes, and they're going to be kind of more engaged and feel more satisfied with the care. So it's important to identify patients that are at the low end of the scale, because they're going to need more support, and you're going to have to spend a little bit of time up front kind of working through those before you just start giving them things to do. And one thing that came up through our survey, for example, was just the importance of health education. So by far, patients say, we asked about what are the things that would be most important or most helpful for you in terms of getting that behavioral change support. Patients said education and keeping a treatment plan simple, doing things like goal setting, planning, action planning, or kind of identifying commitments that they should make, and then receiving practitioner monitoring feedback was the other kind of top three sought after tool. And when we talk about patient education, of course, there's lots of ways to do this. Some practitioners prefer to have their own content. There's obviously a wide variety of resources available online. We do have, just to mention here, over 150 kind of evidence-based, beautifully designed resources within the Fullscript resource library. So these are actually medically reviewed by our Integrative Medical Advisory team, which is a host of practitioners with different graduate training level in nutrition and health sciences. And so we've developed a lot of these different types of resources that you can use to just basically deliver this directly to your patient. And this is going to help give them the information you need, or they need. It saves you time as a practitioner, and just helps with ultimately improving adherence. Because again, if you're giving a patient a recommendation and then you're following that up with an educational resource to give them, on the way out of the office, or to take home to read later, they're going to be more likely to kind of look that over in between visits, stay engaged with their plan, and then have better outcomes long term. And just a few screenshots here of what these resources look like in the app. So you'll notice the new resource library feature, where again, you can browse by category and you can attach these, you can view them and attach them directly to a treatment plan. So aside from patient education, which is a fundamental component, obviously, we want to make sure that you're keeping treatment plans simple. And this is probably one of the things that most practitioners, especially earlier on in their careers, myself included, are most guilty of. It's overcomplicating treatment plans, right? So a lot of us receive, a lot of advanced education and learning and spent a number of years learning about how to come up with the best treatment plan for a patient. And the instinct when you see a patient with, 5 or 6 different health concerns is to say, okay, we're going to do this and this and this, and we're going to add this, and you're going to do great. We've got, 15 or 20 different things to work on, and it's the best plan ever, and you're going to do awesome. And most patients, even in my experience, will leave and they'll be overwhelmed and they won't really do any of them. They might pick out a couple things that worked, but for the most part, it's really hard not to kind of want to have that kind of approach and to kind of block that instinct. But if you can think about, make a treatment plan and then cut out 70% of it and say this week or for the next 3 weeks, just focus on these 3 things, I swear you're going to see more and more success. And it's surprising, even like the most basic and simple kind of recommendations to us as practitioners, will cause tremendous improvement for your patients. And then, like I said, those small wins make it so that they're more likely to take on the bigger challenges. So just a few stats here. When it comes to simplifying supplements, for example, using things like pill packs are really helpful just to kind of keep things organized. Within the Fullscript platform, for example, you can, maybe you might want to prioritize supplements, right? So only recommend a couple. You can think about the frequency of dosing. So choosing products or recommending dosing based on having to take it once a day versus 3 times a day. Maybe having combination products. If you have a couple ingredients you want to recommend, see if you can find a product that has all of them in that one product. So that, again, just things like reducing number of capsules to take is one thing that's helpful for supplements. So now that we've focused on kind of engaging our patients, making sure they're motivated, we want to empower them and keep things simple to set them up for success. I just want to take a few minutes here and highlight some of the specific behavioral change techniques that you've probably heard of, but didn't realize that they're actually fairly evidence-based and they're specific to different barriers that come up in behavioral change. So we actually asked in our survey, what are some of the different strategies that patients use? And we received 360 different kind of open text responses. And so, I mean, we won't go through those obviously, but it's helpful to see that you can group these into different themes. And so behavioral change techniques, or BCTs, is the actual technical term for what you would call things like goal setting or having an action plan or providing reinforcements. And there's a lot of different research out there to look at which techniques are more effective depending on the type of barrier that you've encountered. And this is a great tool that I encourage everyone to check out. We definitely won't go through this in detail, but it's called the BCT Theory and Technique tool. Please Google it and check it out. But it basically helps. It's basically a matrix that helps you identify, once you've identified kind of the barrier to change, what are the different types of strategies. And so the green boxes here represent kind of positive research or positive evidence for those individual things. So check that out. It's a good tool to use to give you a starting point of what to focus on. And these are some of the examples of what those kind of barriers and the appropriate or applicable evidence-based BCT would look like. So if you think, well, my patient is challenged with the actual skills of completing a behavior, then obviously you want to do something like demonstrate that behavior. So you can either do that for them, or you want to consider resources that demonstrate the behavior, looking about things like, if it's exercise, for example, recommending a personal trainer, an app, providing videos, handouts with images. So that those types of things are going to work if it's a skill that they're having a problem with. But if it's a matter of finding time to do those things, then providing them with videos on instructions is not going to help, right? That's where you need to do something else to actually work through them to figure out, well, how are we going to work this into your schedule? And let's make an action plan maybe based on that instead. And again, we won't go through these in detail, but they'll be in the slide deck for you to look at afterwards, and the recording as well, of course. But essentially, just to highlight here that different BCTs will have a different level of effectiveness. Generally speaking, most BCTs, if you recommend something, you're going to have about a 10 to 20% improvement in adherence and ability to change behavior. So that might seem small, but it's important to keep in mind that these small changes and effects do add up over time. And if you're starting to kind of stack a couple strategies on top of each other, you can see upwards of a 50% improvement in a patient's ability to change and follow their plan compared to maybe using an inappropriate BCT or not doing anything at all. And just to highlight a couple of the common ones here that you might be familiar with, obviously everyone has heard of goal setting. People probably set goals with their patients, but it's important to keep in mind that, there are evidence-based ways to do this and lots of great tools out there that you can rely on so that you don't have to do it all yourself, right? So we have a designed worksheet here, again, in the resource library that helps you work through this with a patient, or they can do it on their own. And then consider other types of technology, different apps, things like that. I have a number of patients that use the Noom app, for example. So this kind of provides the ability to set goals, have often and frequent kind of checkpoints to look at, and keep them engaged with that plan. Another kind of core strategy here would be feedback and monitoring. So using different types of feedback as well, help keep them engaged in the plan. So talk to your patient up front about what they should be doing or what they're interested in doing, asking questions like, what do you think would be helpful? Like, would you like to use an app to track your food intake? Would you like to use maybe a different app to track your medication or your supplement intake, so we can actually see how often you're able to take these things? And maybe it's not technology, maybe they're not open to different apps or devices, but have that conversation with them. You can always go back to kind of paper resources to do that, or finding different ways to communicate. Here's just some examples of different types of biofeedback devices that you can consider. So everything from, Fitbits to Oura Rings, glucose monitors, all really dependent on the health concern and what you want to monitor. And again, the patient preferences, how much they want to pay for something, how interested they are in using this type of technology. And the last thing in terms of a specific BCT is going to be that reminder and communication component. So keep in mind that you need to communicate often with patients. Most patients that I've had that tend to drop off in terms of return visits, it's really just a result of not communicating, right? So they feel hesitant to reach out. Maybe things were unclear with what they should be doing, or they took a little bit of a break, and then the longer it goes, the less likely they are to return. So don't be afraid to kind of have those reminders, check in with patients. Most of the time, they're not, it's not going to upset them. They're not going to be angry about it. It can be helpful. And we do see an improvement in adherence just from having simple reminders alone, right? So 10% fewer missed appointments when patients are given a reminder. And when it comes to things like supplement refills, for example, there's some different tools and functionality within the Fullscript platform to do this, either directly yourself or automated features as well. Here's a few just screenshots of some of the other kind of tools I like. So MediSafe is a great app for medication adherence. So they can actually indicate, which medications they've taken, and if they've skipped a dose, indicate the reason why. So it's a great form of feedback and communication that can happen asynchronously when you're not directly with them, just to kind of keep track of that adherence. And there's lots of, 50,000 apps in the Apple and Google Play stores right now related to just lifestyle change and behavioral change support alone. So think about these options, talk to your patients about what they've tried in the past, what's been successful or not. We did find in our survey that 82% of patients would consider using technology. And so it is important to consider, especially, as more and more options become available on the market. And if you're unsure about how to choose from those 50,000 apps, look into something called the Mobile App Rating Scale. Again, not to highlight any particular apps here in terms of being better than others, but these are a few that were kind of higher rated on the scale, just in terms of being evidence-based, maybe a little bit more user-friendly, having certain functionalities. Those are all important considerations, especially when it comes to kind of accessibility for patients. And just kind of a fun image here to share the future where technology is going. This is a snapshot of the Zwift platform. Basically, this is all about the idea of gamification and supporting lifestyle change. So the ability of the option to kind of engage in virtual exercise races. So this would be hooked up to your exercise bike. And there's a few different companies out there that offer this type of technology now. But tracking your heart rate, tracking, pulse, calories burned, everything like that, and actually getting to compete virtually with other people. It helps to create that community component and keep people engaged as well. So consider something like that. And just to finish up here, a couple things just on how you might use Fullscript specifically to support behavioral change. Again, regardless of whether you recommend supplements or use a supplement dispensary virtually or another platform, Fullscript does offer the opportunity now and the ability to provide education and provide some of those communication features we talked about, right? So this is just a few screenshots of the different resources that are available within the app. We have here the behavioral change white paper, which again, you can go to the landing page for that. That link should be in the chat, or it's sent through kind of the email for the registration today. And a couple of screenshots of the different questionnaires that are available, the worksheets. So like I said, we have over 150 different handouts. So there's lots of tools available to help with kind of providing that support. And in terms of the adherence side of things, keeping patients engaged, helping to make sure they follow that treatment plan, a few features to highlight here. One is the Adherence Survey. So this is actually an automated survey that goes out to patients. So if they haven't ordered a supplement plan that you've sent them after a week, quick survey to indicate, is there a reason why you didn't order this? And you get that kind of feedback directly to your account as a practitioner. So I can see things like, well, they said they were too expensive, or it was too much, or they didn't understand. Or, in one case, I had a patient reply this morning that just said, I am going to purchase, but I'm just not ready quite yet. So at least that tells me, okay, I don't have to keep bugging them about it. I know that they have the option to communicate if they need to, and they'll ask some questions there. A few other things, refill reminders, auto ship, adherence dashboard, where you can look specifically at who has ordered supplement recommendations over the last kind of 30 days or so, and send automated reminders for that directly as well. And again, whether you're a Fullscript user or not, we do integrate with a lot of different types of EHRs and different health systems. So hopefully there's something there. If you don't want to use, or if you have your own EHR system, there is integrations available for that as well. So just to summarize here and wrap things up, again, behavioral change, I think we've kind of driven it home here that behavioral change is probably the greatest barrier to actually experiencing long-term health. And that's, that's no major surprise. It's nothing new, but we do need to remember that, it is kind of the most important thing you can do as a practitioner. It's more important than having even like an effective treatment plan. You also need to just think about whether or not they can follow it, right? So if you can focus on providing better adherence, setting your patients up for success, and being kind of their adherence partner throughout, then they will have better outcomes. They'll be more satisfied. And for you, it also leads to a more successful practice. Be aware of the top areas like cost, time, lack of motivation, and lack of knowledge. And the more you can work to identify those barriers, the more you can focus in on, okay, now that we've identified barrier X, we're going to provide solution or strategy Y to work towards that, right? Explore the barriers, like I said, will help narrow in on the most effective strategies. So thinking about kind of whether or not they're ready to change, whether they're engaged or motivated, use evidence-based interventions. We highlighted a few today, and then consider the role technology can play. So I think that's a lot for a 50-minute presentation. I know we covered a lot there, but thank you for kind of staying with me, and I hope this helps to give everyone kind of a good overview of the topic of behavioral change. As I mentioned, we've just completed a very comprehensive white paper, which is beautifully designed. It's about 80 pages long. It's really digestible, though. There's a lot of great summary content in there, and that's available for download through the link that'll be shared in the chat. And I did receive a couple questions in advance, so maybe I'll just touch on a couple of those quickly, and then we'll open it up to any further questions from the audience. So one of the questions I received, and Tabby, feel free to interrupt if there's anything you want to bring up or highlight from the—
No, that sounds perfect. That'd be great if you could answer those questions first.
Sure. Yeah. So one of them was just kind of, why is behavior change important in nutrition, and for specifically like a nutrition audience, let's say. And obviously, I mean, it's most people who are trained in nutrition will know this, but obviously diet and nutrition are a fundamental factor in health outcomes in chronic disease. We know that regardless of what age you're at, or even what stage of health, whether it's, acute or even, advanced stage cancer, nutrition is going to play a role in the quality of your life. We've seen time and time again that restrictive diets do not work. So you really need to focus on identifying all the different possible barriers for your patient individually to healthy eating, and kind of why they fail. And then, when I have patients, for example, that look for support with weight loss or weight management, I often ask, well, what have you tried in the past? And let's talk more about that. Like, tell me about every diet you've tried, and when have you felt like things went well, and when did things not go well? Let's learn from some of those failures so that we can make corrections and kind of walk through it together. And ultimately, behavioral change is all about making small incremental changes and improvements. And really all the behavioral change principles and strategies are relevant when it comes to improving nutrition and diet long-term. One of the other questions was, how can we use, as dietitians or nutritionists, how can we use technology to support behavioral change? And again, this would be relevant to kind of any integrative practitioner, but I think specifically about, just familiarizing yourself with the different types of technology, EHRs, integrations, and apps that are out there. Like I said, Fullscript offers questionnaires. It's free to sign up for an account. You don't even have to send supplement treatment plans if that's not part of your practice or you're not ready to use Fullscript for that yet. You can just take a look at our resource library, download handouts, send them to patients. We have 150 different resources there. So providing education and using some of those communication tools might be a good starting point. When it comes to technology, identifying the barriers that they have, because that's going to help you focus in on specific resources. So whether it's a goal setting template, education handout, or specific devices or apps. So. And then, there's a question about kind of, I'm a chiropractor. I've noticed sometimes my patients don't return. What can I do? And so this is actually touching on behavioral change, but also touching a little bit on adherence as well, right? So just whether or not patients are engaged in their plan. And to that, I mean, I'd say first and foremost, remember that there's a lot of different reasons for that. So don't take it personally. Make sure you're giving your patient kind of time and some space. So maybe they were, a little bit overwhelmed up front with things and they just need some time to process, or maybe they're aware that they're not really at that stage where they're ready for change, and maybe they will be in a few weeks or a few months from now. So that being said, though, I mean, don't ghost them. Keep some regular communication and follow-up. I like to do things like, an email or a phone call occasionally, I call it like a friendly check-in. Ask questions like, what can I do to best support you at this time? What do you think I can do to help? What are your needs at this time? What questions do you have about your treatment plan? And again, maybe upfront asking again about, especially for a chiropractic where you might have frequent visits, a couple times a week for the first few weeks or for your first few months, asking them again, learn about their needs and their preferences. How often do you actually think you can visit? I really don't like signing patients up for kind of contracts or anything like that, or commitments, but maybe just learning about what's reasonable for them, and can we modify that plan so that they still remain somewhat engaged instead of having to drop off entirely. And keep in mind 10 and 20% of patients won't be ready for change. So you need to kind of be clear upfront with the expectations and kind of the way you work as a practitioner. And this is what I outline, and this is kind of what to expect as a patient. And the last question here was just on, what kind of assessments can a nurse practitioner can use to improve outcomes. One comment was just about how, nurse practitioners do so many different things. So the kind of opportunity there is that you have a lot of different areas where you can kind of dial in and provide support based on what their needs are, right? So again, you'll hear this a lot, but first you have to talk to your patient. You have to figure out where the gaps are and where their barriers are. So become really good at motivational interviewing to learn that and to kind of develop that skill. Use some of those valid questionnaires that I mentioned. So the Eureka, Readiness to Change, and the Health Empowerment Scale. Those are available in the resource library, like I said. And make sure that you're measuring and tracking things in between visits, right? So I love the phrase, you can't improve what you don't measure. And it's really true. You have to be able to provide objective feedback to your patients to show how they're improving. So whether it's related to medications and supplements, or just a food record, or monitoring symptoms, try to use those even if they're not improving over time. It helps to track things, and you might find after 6 months that they actually have improved a little bit, and maybe they were just too dialed in still on the fact that they were still having symptoms to notice that they've actually improved a little bit, and that can be somewhat positive reinforcement for patients. So hopefully that helps kind of answer some of those questions, and I'll just leave it at this slide again. The link for the landing page should be in the chat or in a follow-up email. If you do have any questions about the presentation, please feel free to reach out to me or email medical@fullscript.com. So thank you very much for joining. And Tabby, were there any other questions from the audience?
Yeah, we have a few questions.
Sure.
One participant, Maria Rodriguez, asks, within the report, did you all classify the sample by geographic location by any chance? Is that in the fuller detailed report?
So the survey was limited to patients in the US. So we didn't look specifically at location beyond that. We didn't at the time really feel like it would matter so much about maybe state, but obviously that could be influenced by the type of practitioner they see or the health care that's available. So it's a great question. I think something to maybe do in a follow-up survey, but we also didn't want to overwhelm them with too many questions. So
of course. Also, just some of the links, I think maybe if you could provide us after the call, the direct link to the app, the mobile app, the map, I think it was called, and then the two of the links weren't working. So we'll get
Okay.
those for you, David. And then we'll put all the links and stuff into the AIHM membership platform. So you can grab them there afterwards, and also the your slides or PDF if you're able to share those.
Yeah, absolutely. I can send those afterwards. So.
Just a couple thanks. Linda Smith says, thank you for your presentation. You outlined some great reminders, but also new things to consider. So it's always just great to reorientate as clinicians to, how we really get behavioral change to happen with patients. It's just so critical, and yet one of the biggest challenges. Sergio Lozano asks, patients seen in office have an appointment, but many people have obesity or chronic disease. Is it possible to identify people who need help as a preventative measure? Have you all found any successful techniques to this?
To be honest, I mean, we haven't looked too much into that yet. I mean, I think it's a great call out. I mean, it's kind of good and bad news. I think the good news is that most patients in North America are going to have some type of chronic disease, just based on the statistics or risk of overweight or obesity, that whether they're presenting with an acute symptom or something more general, it's probably going to identify during that appointment other things that you can focus on in terms of prevention. So, but I would say if you're trying to identify populations or patients that are at risk, that's where kind of reaching out, being a little bit more involved in your community if possible is a great starting point. Put on some seminars, run some webinars, be active on social media in your geographical area or wider if you're kind of seeing patients virtually. That can help just kind of educate around these risk factors, because you're right, a lot of patients won't necessarily be thinking about change or the importance of lifestyle until they're at a point where they really need that support or they're facing chronic disease.
Great. And we are out of time. Thanks, Jess. The links that you put in the chat did work for the download, so that was perfect. Thanks for providing those, Dr. Nee.
Yeah, my pleasure. Thank you.
So just to finish up today's webinar, and I just want to thank all of you that came to the Zoom meeting today, and then also all of you who are coming in from the live stream on Facebook. I really appreciate you all being here. And I wanted to invite you to the AIHM 2022 conference, Disruptive Innovation and the Future of Health. Our conference, we are finally back in person this year, October 28th to the 30th. We'll be at Paradise Point in San Diego. And we are very excited about bringing the community together. We are nearly sold out for those in-person seats. So if you're interested in attending, we encourage you to go, and we have extended the early bird deadline, so you can still get early bird rates. We'll also be offering it online, so you can attend virtually if you're not able to join us in San Diego, but we really hope to see you there. And we are building a global community. AIHM is a community of agencies, individual members, academic institutions, organizations, researchers, all of us coming together to really transform healthcare on this planet. So we invite you to become an AIHM member, whether you're an individual practitioner or you're an organization that wants to work with us more closely so that we can build that global community. You can connect with us on all of the relevant social media channels. Our handle is AIHM Global. So all of our presentations that happen at the wellness webinars are available to watch again on our YouTube channel for free. You can share those with anyone. And if you want to get additional resources, you can log into the membership platform and get those. But please join our Facebook page. We post all of the webinars and live stream to that page as well, which is also at AIHM Global. And like I said, consider joining the membership. So thanks again, and we really look forward to seeing you all at the next wellness webinar. And Dr. Nee, thank you so much again for coming and presenting today. It was really just a wonderful presentation, lots of great resources, and we really value our gold sponsorship from Fullscript. We love working with you all, and we look forward to seeing you as well at the AIHM conference here in October.
Great, my pleasure. Thanks again for having me.
Okay, bye-bye, everyone. Have a wonderful weekend.